You've joined Original Medicare. Now you're trying to decide exactly what your Medicare needs are. As you're shopping through those Medicare needs, it's important to really understand the pros and cons of each plan. Remember, if I've said it 1,000 times, there's no such thing as a bad Medicare plan. It's really what fits your personal needs. So let's dive into Medicare supplements and Medicare Advantage and really talk through some of the differences that our clients find make their decision easier. First, there's a myth that all Medicare plans are created equally. Plans are very different. Medicare Advantage plans are all unique in the fact that they have different co-insurances, co-payments, max out-of-pockets, and benefits. One of the advantages to a Medicare Advantage plan is that they often have additional benefits such as dental, vision, and hearing built into them. It's widely known that dental, vision, and hearing is a large gap in Original Medicare. Preventative services are not provided by Original Medicare for these programs. Preventative services are not provided for these services within the program. What we find then is that clients want to make sure that they can still take care of their teeth, ears, and eyes even after they've joined Medicare. So Medicare Advantage at times becomes the right decision for them. Now, that's not to say that you cannot get a standalone plan like a dental, vision, hearing plan that you can partner with a supplement. But outside of that, let's continue to focus on the Medicare Advantage plans. Additionally, Medicare Advantage plans will oftentimes have prescription drug plans built in. One of the biggest pros that people like about Medicare Advantage is they feel like it's one plan that gives them most everything that they need to ensure that when life happens, they're fully covered. With a Medicare Advantage plan, you will find that at times who you can see for your primary doctor can be decreased. Generally, Medicare Advantage plans will work off of networks. As you're deciding which doctors that you want to see or what facilities that you might have to attend, you will have to decide what is in-network that you can use with a plan. That becomes one of the cons of Medicare Advantage. People will not want to always have to limit their doctor access by their plan. If that's something that's important to you, you should consider a Medicare supplement plan. Medicare supplements plans have one Medicare network. Any doctor that accepts Original Medicare will fall within network for a Medicare supplement. It's important to note that many people like this option so that no matter what happens with their health, they can pick any doctor that is seeing patients and available within any network out there. With a Medicare supplement, you're not always required to get any kind of pre-authorization or referral. Medicare is going to pay if your doctor has said that it is medically necessary. With a Medicare Advantage plan, depending on the plan you get, whether that's an HMO, a health maintenance organization plan, or a PPO, a preferred provider organization plan, you may have to get a pre-approval or pre-authorization to see a specialist or have a procedure done. This brings us to one of the second biggest myths. Your doctor is always in control of your health program. With Original Medicare, you'll find that the government says we're not in the business of healthcare. Therefore, the government does defer medical necessity to your doctor. If your doctor says that something is needing to be done, then the government is going to say, your doctor made that decision, Medicare is going to pay. For example, when my dad was playing basketball with my kids, he tweaked his knee. He then found out that he'd have to go in, and after the doctors reviewed it and had some x-rays, they wanted him to get a knee replacement done. Because Original Medicare defers to his doctor, Original Medicare would have allowed him to have that knee replacement done, and the Medicare supplement would have paid without any issue. He wouldn't require any pre-authorization for that to occur. Now, if my dad had done that same thing with Medicare Advantage, then before he could have it done, he would have to seek approval from his carrier to have that surgery take place. Medicare Advantage companies are in the business of health insurance, so they do not always defer medical necessity to your doctor. These are some of the horror stories that you may have heard people tell about needing to get approvals for some kind of procedures. At times, you can have to appeal or fight to have procedures approved. Oftentimes, some clients don't have the time nor maybe the patience to wait to have that done, and they end up having the procedures done with costly out-of-network expenses and then having to appeal to have things paid. So, when life happens, who do you want to decide your medical necessity? Finally, Medicare is not always portable. Generally speaking, if you're going to be traveling across the country or internationally, Medicare supplement plans have the broadest coverage for emergency coverage. In a Medicare supplement, because there's one Medicare network, you don't have to worry about whether a doctor's a network to seek coverage in the states. Most Medicare supplement plans, not all, will have foreign network coverage available to you. All Americans can seek emergency coverage if they need at any time, but how the insurance covers them or how it will pay is completely subjective to the plan that they pick. With Medicare Advantage, these gaps are starting to close, but many plans still do not have national coverage, and while some have foreign coverage, many do not have any. These are just a few things that you should consider as you're looking at the pros and the cons of Medicare Advantage and supplements. Finally, the biggest thing that people want to decide is how their coverage is brought to them. When you go through a Medicare supplement and a prescription drug plan, oftentimes you are going to have two separate plans. Once you join your supplement plan, you have it for life as long as you continue to pay your premiums. Your prescription drug plan is important to review each year because if your maintenance medications change, the annual election period is when you can make those changes without any issue. With a Medicare Advantage plan, your plan is subject to change each year, and if it's grandfathered or closed, you will be moved into another plan. During the annual election period, you'll receive an annual notice of change or an ANOC letter where you can decide whether you're going to roll with the plan or change to another plan. Remember, all the choices that you need to make are available for you, but you may need help to sort through those options. Give us a call and we'll help you wade through the options and pick the right plan for you today.